Thank you to our sponsor, MBA Growth Partners.
Welcome to Studio 501c3. I'm your host, Kim Jones, and I want to thank Montgomery Community Media for letting me join them in bringing you valuable information and resources. This show features nonprofit organizations that the IRS has designated as a 501c3 charity because they provide a public benefit. And in most cases, your donations to them are tax deductible. Today, my guest is Dr. Ana Izquierdo-Porrero, MD, PhD. She's the Executive Director of Care for Your Health. Their mission is to provide multicultural care to elders, promote aging in place, and support life changes. Dr. Izquierdo-Porrero, welcome.
Thank you. Thank you.
So tell us briefly about your programs and your services, and then I'm going to ask you a little bit about the new hub up in Germantown.
Yeah, very exciting.
I know.
So, Care for Your Health started in 2008, and we honestly started as a small nonprofit clinic for elders. And we started with this idea that health delivery should happen where people live. You should not have to drive 20, 30 minutes to go and see your doctor, right? We should have the same we have neighborhood pharmacies and neighborhood supermarkets, we should have neighborhood primary cares, right? So we created micro practices so that people could come to their neighborhood to see their doctor. And, after a while, we started seeing people that didn't show up. What happened? Oh, I had a stroke and I cannot get out of bed, or my son got a job and now I don't have transportation, or, So we started the home visiting program, right?
Okay.
This idea of where you are is where health needs to happen.
Right.
So, we always design new programs based on what we see in the community. The next thing we saw was, a lot of our people were getting to the end of their life and they needed less aggressive treatment and more supportive treatment. So we started the community palliative care program.
Okay.
And then, I'm saying this like it happened in 3 weeks, but it took 15 years, right?
Right. But you learn as you go along and things change.
And that's what
you're addressing the changing needs. Yeah.
Exactly, right? You need to be adaptable. And the big example of adaptability came with COVID, right? So the governor closed on March 16th. On the 17th, we tested our telehealth equipment. On the 18th, we were fully telehealth, right?
But you had already been doing some telehealth?
I'd been doing telehealth, yes. Okay. But it was, at that time, we did not get paid for the telehealth, so it was for the convenience of the patients, but we were like, we don't want to grow this because we are not going to get paid, right? But with COVID, not everything was negative. With COVID came the idea that a lot of things in medicine can happen. Like if I need to give you some lab results, do we need to see in person? No. If you have belly pain, I need to see you in person. But that idea that certain things can happen remotely, right?
Right.
But we were uniquely positioned to do the work that needed to be done with COVID, right? Because we were already embedded in the community. We had very flexible units. So COVID comes and we started testing in the community, in the streets, in the supermarkets, in the churches, in the apartment complex, you name it, we would go, right? Then the vaccines came also, and I think right now we're up to 70,000 tests and vaccines in the community. So we've been really out there helping get resources where they are. So here we are right now, right? And we're still seeing right now the need in the community is unbelievably high.
It's tremendous.
Yeah. And it's not, people are like, well, this is COVID. No, the need was there. But I think what happened is that a lot of this need was invisible to a lot of the community.
Okay.
And now it's more visible, right? And then you add the COVID, which a lot of people lost jobs, lost homes, lost there's a lot of loss, and
Right.
you add the inflation, we still have a lot of problems. So we start doing pop-up clinics. So we will go again, churches, wherever, whoever calls us, we
So do
go.
you announce as you're going to these different places, people can kind of follow along and know,
So
oh, I can go there this week, but there may be a pop-up someplace else next week?
So what we work with our trusted partners in the
Hmm.
community.
Okay.
So they are the ones that decide how they want to do it. If they open to everybody, we see you in a pop-up, you become our patient. So we'll see you in one of our two sites anyway, right? If you need
Right.
to be seen. So that's not that problematic. And then everybody that has access to that particular pop-up continues to have access to it. But we trust our partners in the community to tell us how they want to do it. So
Okay.
we
I want to ask you because in about 1 minute I'm going to have to go to a break,
yes.
but I want to ask you about the initiative that Shepherd Pratt and the Healthcare Initiative Foundation helped to put together, bringing the wellness organizations together in the hub in Germantown. So, can just 30 seconds, can you kind of
uh,
tell me a little bit about
Labor of love, right?
yeah,
And this idea of community and
right.
having a hub. Germantown has
Mhm.
traditionally been a desert for nonprofits. And I think the work that Crystal Townsend with the HIF did to bring us all together, there are 10 partners there with different services. It's very exciting. It's very exciting.
Yeah, I'm sure. So, yeah, we hope to try to get more information out about that. And once we put up your website on the show later, then, people will also know how you're working with them. So
Yeah.
that is a very exciting program. And Crystal was a true visionary in trying to pull that together. And I was proud to be a part of the early stages of that several years ago. But we're
7,
going to
I think.
yeah, it's
7.
been exactly. It's been 7 years. After the break, I want to come back and talk a little bit more about some challenges and some other common things that people ask
Yeah.
when they're getting services from you. So, Studio 501c3 will be back after a short break to hear more about the programs and services provided by Care for Your Health.
Today I'm going to talk to you about physics. Come on in, girls. Let's go. This is the first rocket to get humans to Mars.
Really tall.
I'm a rocket structural engineer designing and building parts of the rocket. You are the generation that will be stepping foot on Mars. Do I have a group of astronauts on my hands?
Yes.
You can become a rocket scientist or whatever else you want to be.
Can I get the now bar, please?
$1.
Have a good one.
Got it.
Hey, what's going on?
Hey.
Hey, let me get a now bar.
Sure.
$1.
Appreciate you.
Got it.
There are 16 million children struggling with hunger in America. This is a serious problem, but one we can solve. Visit feedingamerica.org to help. Together we can solve hunger. Together we're feeding America.
Welcome back to Studio 501c3. I'm talking with Dr. Ana Izquierdo-Porrero, Executive Director of Care for Your Health. So, obviously, COVID presented, as you said, a big challenge. Have there been other challenges to the multicultural care that you're providing and to the seniors that you're providing that care to?
There's always a care. For instance, in the county, we have 22 adult care centers. Not one speaks Spanish. Yeah, they have a couple of people that speak, but there's not a Spanish speaking multicultural. So how do we give access to our elders as they age and they decide to stay to these services in a language. And people are like, well, they've been here so many years, do it in English. Yeah, well, what if you have dementia and you forget the languages you learned? You know, what if you
But then
came
you have
here?
that long-term memory. So yes,
Correct,
the language,
right?
the original language is there. Yeah.
So that's one of the big ones that we in the next 5 years are going to be working to get these services in place.
Mhm.
The other big one, and I think, you know, people are surprised when a healthcare provider talks about this, but it's workforce development. Okay, if we want to keep people home, we need to have the workforce, we need to pay them well, we
Right.
need to train them well, and we need to use the assets that our community has, which are all these young, you know, people that really want to make a difference in this world,
Sure.
and give them the resources and train them so that they come into these professions, right? Mental health, big challenge.
Right. And I imagine that would be a common question that those that you're serving also have as they're transitioning through the life cycle and saying there's not enough helpers for me to stay in my home, or there's not enough skilled, care because people are doing other things. Or so I think that's probably a common issue on the other side as well, not just those that you're trying to encourage into the workforce, but those who are getting served.
And it's going to be a crisis not only for the low-income community, but the community as a whole.
Right.
And how we address it as a community is going to be very important, right? How do we make sure that we develop the assets that we have in the community so that we can keep our elders at home, our disabled community at home and well supported? So workforce development, I think, is going to not only be a challenge, but it's something that we're going to have to pay attention. And how do we become more creative? How do we are starting educational programs within, like we're going to start a CPR course for people in the community that need a CPR to find a job taking care of them.
And that's a meaningful way to engage the broader community. Yeah,
Correct.
excellent. What other programs? We've only got about a minute left, so I want to let you kind of finish out.
And then the other thing that we're going to do is look at expanding services, right?
Okay.
The first one is podiatry. We're looking at dentistry, optometry. How do we provide all these services so that we can not only have them in our clinical sites, but in the homes?
Okay.
So that is the other piece.
Those are very important. I'm glad to hear that. This is very important information. And thank you, Dr. Izquierdo-Porrero, for sharing all of this information about your programs and services. This is very important work that is life-changing. So I'm going to share your website. If you want more information, go to the website at care4yourhealth.org. I'm Kim Jones. Thanks for joining us, and come back for another edition of Studio 501c3 on Montgomery Community Media. Thanks for being with us.